So this is the question. You have a 55-year-old male is in the emergency room, right? Suspected heart failure. How can you distinguish between, figure out if this patient has what? Heart failure related to right-sided heart failure or left-sided heart failure, right? Right heart failure. And this is, maybe I'll put it here, right heart failure, left heart failure, and then chronic heart failure. So, and these are findings that you have that you got to figure out that this patient is in heart failure, whether it's a right-sided heart failure, left-sided heart failure, or chronic heart failure. If you know, you can put down your answers, but this is, I will label this 1, 2, 3, 4, 5, 6, 7. So how do you classify? Do you think this is a heart failure? If it's heart failure, is it right-sided? These features. So the next, basically, based on exams, the suspected heart failure. How would you know that those symptoms is associated with the right heart failure? Edema most of the time is associated with the left right heart failure. So based on your content. So if you need content, this Adapt NCLEX, you can check. You see Adapt NCLEX, you can click, you can go online. Our YouTube channel, we have a bunch of courses that you can join, or you can just watch the free videos. So which of those is consistent with the leg edema is right heart failure? How about dyspnea, enlarged spleen, right? JVD, autopnea, leg edema, low urine output, and ascites, right? So which of those do you think is associated with the right or left heart failure? Dyspnea is a lung symptom. So lung symptoms are associated with the left heart failure, right? So this is a left heart failure. Another one is autopnea, right? It's related to the lung. So that's a left heart failure. And then we have something we call forward flow. Forward flow is your blood pressure is low or you have low urine output. It's also associated with left heart failure. And ascites is mostly fluid, it's systemic congestion. So this is right heart failure. And a large spleen is consistent with that, and in addition to JVD. But then chronic heart failure, how would you know? You have to know the difference between when the NCLEX asks you about heart failure, if they want you to worry about right heart failure, they will say right. If they want you to worry about left, they will say left. If they don't say anything, they mean chronic heart failure. It's not memorization, but concept. So there's something associated with chronic heart failure that you should know. And that keyword is both left plus right. Therefore, every symptom is associated with right or left is also associated with the chronic heart failure. So this guy will be taking all of them. All of them will have those symptoms. Anybody with the chronic heart failure will have dyspnea, enlarged spleen, JVD, autopnea, low urine output, leg edema, and ascites. And that is classic associated with the heart failure. It's not just right or left. The right is I call it systemic congestion, right? And then the left is pulmonary congestion. So that's the pulmonary symptoms. And a chronic heart failure is both. You both have systemic congestion and a pulmonary congestion. We have the same patient, different patient. Probably this is a 45-year-old, maybe male, is in our emergency room in the ED with what? What do they call it? Abdominal pain. So he has abdominal pain. So we want to find out, the nurse who is doing the evaluation, she doesn't know if she thinks this patient may have appendicitis, or she thinks this patient may have cholecystitis, or they think the patient may have diverticulitis. make you master the content and think what you think, right? So who have right lower quadrant pain, who have left lower quadrant pain, who are right upper quadrant pain, who has elevated white count, antibiotic, or right shoulder pain, who need IV fluid, who need a dancing trunk. And let's change this, assuming this may be a female. So I would say beta ACG test, like that. So what do you think? Of course, appendicitis is a right lower quadrant pain. How about cholecystitis or diverticulitis? Where do you think the pain would be? Where would the pain be? Left lower quadrant pain is mostly associated with diverticulitis. And the right upper quadrant pain is associated with cholecystitis, right? All of them are going to have elevated white counts. So you should not be surprised because it's an IDs. Look at it. If all of them have IDs, then they should have signs of infection. So all of them will be elevated. They are going to need IV fluid, right? And then they are going to need Zofran if they vomit. Of course, they are going to need pregnancy tests because they may need surgery. Some of them, this and that, may need surgery right away. Diverticulitis usually resolved, right? And of course, antibiotic, they are going to need antibiotic. This is designed to show you some key concept about it. How about right shoulder pain? Who is going to have right shoulder pain? Right shoulder pain is a referred pain from right upper quadrant pain. So you go to the right upper quadrant pain. Therefore, based on the pains I've given you, the location of the pain of the right upper quadrant will be referred to right shoulder pain, and that will be cholecystitis. This is how you can distinguish all of them in an easy, appropriate form. So when you see a question related to GI pathology, you say this is the way you should think about it, based on location and based on ability to see what is going on. This is how you can figure out with that. That is the table I want you to be familiar with as soon as possible for your test. So 45-year female in the emergency room with abdominal pain. The way you can distinguish them is based on the pain location and based on the diagnosis. The treatment plan changes with that. Okay, questions? Same thing, right? We have a 35-year-old female in the emergency room who the ACP suspect probably thyroid problem. And the nurse, we think this may be hypothyroid. Or this may be hyperthyroid. Okay, so what are we going to be looking for? I've given you things you should focus on when you're reading, and then to be able to distinguish between hypo and hypothyroid is that, right? So which one do you think? Oh, one more, one more, something came into mind. I will give one more. So elevator T3 and T4. So based on what I've given you, who do you think is going to gain weight? 20-pound weight. Who has gained weight based on your assessment? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Which of these patients do you think will have a weight gain? Hypothyroid. The way the concept here is for hypothyroid, everything is what? Think about it. Everything is down except the weight. So down except your weight. And then hyperthyroid, everything is up except your weight. That's all. Then you figure out the content related to that. The person who's going to gain weight is hypothyroid. And who is going to need metamizole? Think about the condition that is causing that. Who will need metamizole? Metamizole is going to block thyroid hormone. Who has too much thyroid hormone? Hyperthyroid. That's the way you think about it without not memorizing. Who is going to need artificial tear? Somebody whose eyes are dry, right? They have a subthalamus. That would be what? Hyperthyroid. Who will need high calorie diet? Is going to be somebody who's losing weight. So hyperthyroid. Need a Lugo solution for surgery. Who have TSH, elevated TSH, who has PT, who need a PTU, who you should avoid high fiber diet, or who you should prescribe propranolol or elevated T3, T4, right? So plus propranolol, plus PTU, plus metamizole, right? That means you're giving to the patient. So who is going to be bradycardic, right? Bradycardia will be hypothyroid. Who are we going to give Lugo solution? Based on the concept I told you, it's going to block thyroid hormones and prevent thyroid storm. It's going to be hypothyroid. Who is going to have elevated TSH? Your TSH is in relationship to your thyroid hormone. So if you have high thyroid hormone, TSH goes down. If you have low thyroid hormone, your TSH will go up. So what do you think? Who is going to have elevated TSH if you do a lab work? TSH is going to be high, like I said, is somebody who has low thyroid hormone. So it's going to be hypothyroid. PTU is going to block thyroid hormone. Therefore, if you don't have thyroid hormone, you should not be blocking it. You should be one who has high thyroid hormone. Who will need high fiber diet? Who can solve that one? It's going to give you diarrhea, or you go more often. It's used for constipation, right? So who is already having a lot of bowel movement, and you should avoid that in them. That's what the question is asking. So who should you avoid high fiber diet? Is going to be what? Hyperthyroid. And propranolol is a beta blocker. It's going to block it. Hypothyroid is bradycardic. You cannot give it to them. So plus go to hyperthyroid. And then TSH, T3 elevated is going to be hyperthyroid. But this is the way you should be able to distinguish. You can do this yourself and you'll be able to distinguish between these conditions as much as possible without any problem. Think about it. When you think about it, it becomes so straightforward. You'll be able to analyze it as much as possible. Any question? Will be 25-year-old female and just delivered. We delivered a 10-pound, maybe 7-pound baby. And then discharge home. Now we want to do, or if she has depression, or if she has psychosis. Postpartum depression, postpartum psychosis, postpartum blue. But you don't think that's what your body is going to ask you. These are little content. I call them on the go. And then I use it to summarize the content associated with something you already know. And when you read and you try to study, I will do that as you get used to the content so that you don't get confused. So these are 3 things you have to know. And then whenever they ask you about blue depression, it's going to be like that. You should be able to distinguish between them. I can tell you the most common one is postpartum blue. And then the onset resolve within 2 weeks, require inpatient rehab and psychotherapy is what? First, let's start with who do you think we need to admit it to the hospital, psychotherapy, and figure out what is wrong with them? Who require inpatient rehab? It's mostly patients who have psychosis. They has to be admitted. And who will need psychotherapy, right, and medication at the same time, is mostly depression. Even though you can say psychosis may need it, but the way it's written, that means that's the final therapy. The final therapy, it has to be require inpatient rehab as soon as possible. That's the final one. But they may need psychotherapy and medication. So somebody will say, I'll put it there. But just know that when they said it like that, this guy need inpatient. He also may need psychotherapy and medication for stabilization as much as possible. And the one that will resolve within 2 weeks is always postpartum blue, right? And then onset within 2 weeks is a psychotherapy. A 78-year-old male, he just had a TURP, transurethral resection of the prostate, right? So when you are the nurse, you receive some orders. Which of those are you going to question? Or which one you don't no need to question? You should know about this, and then which condition should make you worry. Patient step. Do I need a 3-way catheter? Do I need a Foley catheter? Do I need a Foley catheter output to be pink? Right? Do I need some clots within 48 hours in the Foley catheter? Do I need to do enema, or do this patient need IV fluid? This is the content. If I'm doing a lecture, this is what I would tell you to focus on. So what do you think? Should you question a 3-way catheter? If so, why would you do that? Remember, when you have TURP, we got to irrigate the bladder. So 3-way catheter is designed to irrigate at the same time monitor urine output. So no need to question them. The Foley output is pink within 48 hours. Yeah, it's going to have some bleeding. That's okay. 48 hours, you're going to see some clots. That's okay. How about enema? What do you guys think? Enema every 4 hours. You see something you should question, or is it something you shouldn't question? When they do transurethral resection, the bed of where they remove the prostate can bleed, and the rectum is basically behind the prostate. If you put your finger in the rectum and you do the enema, you're going to disrupt the clots and it causes bleeding. So there should be no enema. So this one you should question. They need IV fluid, so fine. The last one for this question is assuming patient Foley output. If the Foley output is maybe 2.7 liters, let's see. And then you IV fluid that you give irrigation was 2 liters, right? Is this something you should question? So this is the irrigation fluid. So patient output in the Foley bag. So 3-way catheter is like that, a Foley, and he has 3-way. One go into the irrigation, one go into the bladder, and then one is the balloon, right? So we irrigating there. This go to the and go into the bladder, irrigate, and then you get the fluid coming out, and this is the balloon. So if we get 2.7 liters, and then we give 2 liters, is this something we should question? The concept here is what? The total output, okay, from the Foley is both urine plus the irrigation fluid. So 2.7 and 2 liters. So irrigation fluid is 2 liters and total output 2.7. That means the patient urine output is what? 700 ml. This is over 2 hours. So 700 ml in 2 hours is more than adequate. Therefore, we should not question that. So once again, follow output of 2.7 liters. Irrigation fluid is 2 liters over 2 hours. You don't need to question this because patient is making 700 ml of fluid, and which is acceptable. Go and she's 10 weeks and prescribe warfarin. Should you question it? Patient atorvastatin for LDL 200 and HDL 35. Should you question it? I get fresh frozen plasma for lips edema after I'm giving Linsinopro. And then I have penicillin allergy. I'm pregnant with syphilis positive, and I prescribed penicillin. What do you think? And I've seen I've been prescribed sumatriptan for headache. I have a history of coronary disease. And then I'm 3-year-old with the flu-like symptoms. I prescribe bismuth, right? So what do you think we should do? Should you question the first order, guys? Number one. Do you want to question it? What do you think? Do you want to question that? Warfarin is teratogenic. Pregnant lady should not get it. So she's going to get enoxaparin. Therefore, you should question it. Atorvastatin is used for cholesterol medication, and then it can decrease your LDL, it can increase your HDL, so you don't need to question it. The treatment for angioedema, most of the time, FFP is very good, so you don't need to question it. How about this? This is a traffic question. Penicillin, allergy, but I have syphilis and I'm pregnant. Are you going to give me penicillin? Yes, because penicillin is the best treatment. This is the only question that sometimes in your NCLEX you say allergy to something you should not give. But this one will desensitize you. Will give you a little bit of it until you don't react with it. So this is the treatment of choice. We don't need to question it. Sumatriptan and coronary disease. Sumatriptan causes vasoconstriction. It can cause headache. It can worsen your, it can worsen your coronary disease, and therefore we should question it. Any patient with sumatriptan is contraindicated in a patient with coronary disease. So these are some of the things I know you know. So, but if they give it to you in a question from this out, you can be very confusing to figure out. It's a concept. And a kid should not be given any bismuth has a aspirin derivative. If you have flu-like symptoms, they should not get aspirin derivative. Otherwise, they get Ray syndrome. But this is the concept. Thank you for watching. Like I said, if you want to join our crash course that is coming up, you get access to it on demand for 75 days, and your quizzes and multiple assessment. These are assessments that are harder than any of the QBank you see. It will be frustrating you, but it's designed to make you master it. These are the contents we'll be covering, and there's more on the on-demand. So take care. It's very cheap.